My name is Elizabeth Zide, and I am an emergency medicine physician, and I've been in practice for over 20 years. I'm also a neuroendocrine tumor patient. I was diagnosed with metastatic gastroenteropancreatic neuroendocrine tumor, or small bowel neuroendocrine tumor, in 2019. When I was diagnosed, I recalled learning about neuroendocrine, or as it used to be called, carcinoid, briefly while in medical school. Because of its rarity and low incidence, not much time was dedicated to the subject of neuroendocrine tumor. The idea being that a provider would likely only see one or two cases, if at all, during his or her career. In medical school, we often learn about zebras, and that when you hear hoofbeats, we should think about horses because they are most common. But we have to remember that zebras do exist, and if you don't look for them, you won't find them. What really struck me at the time of my own diagnosis was that I had no idea I had this disease at all. I did not feel sick. The symptoms were vague and insidious and very intermittent. As a doctor, I prided myself on making the correct diagnosis. It was shocking to me that I had no idea that I had anything going on. Due to the vague symptoms, neuroendocrine tumor is often misdiagnosed for long periods of time before the patient receives the correct diagnosis. What led me to my diagnosis was after intermittent symptoms for many years, for which I did not seek treatment because they resolved on their own, so I figured I was fine. I ultimately had an episode where I thought I had appendicitis. I had intense pain, and I decided to get an imaging test. I was the provider that looked at my test first before it was read by a radiologist, and I found a mass in my liver and several other small masses. Before diagnosis was officially made, since the imaging studies are not consistent with typical cancers, I saw a liver surgeon at a liver tumor clinic. He ultimately took my case to the tumor board. At tumor board, someone looked at my imaging and saw a finding that is very pathognomonic or very diagnostic for neuroendocrine and suggested that was what I had. After diagnosis, I dedicated myself to learning all about this disease. I even saw a patient in the emergency department with neuroendocrine tumor, and I recall treating a patient with carcinoid heart disease once in the past. It is so very important for a provider to think about the possibility of this diagnosis in order to find it. This is the key. You must think about it in order to consider testing for it.